Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today we're doing another lab interpretation. Somebody asked a question based on a previous lab interpretation, a specific question about when somebody might need more T4 medication based on a TSH of 3.5 and a free T4 of 1.19. Now, keep in mind, I don't prescribe medication. This is just my interpretation and what recommendations I would make back to the client and their clinician who prescribes as to whether they may or may not need more medication. When we consider, does a person need more medication to lower the TSH level, this is where we have to ask a bunch of questions. We want to ask, is the person with a TSH of 3.5 demonstrating signs and symptoms of hypothyroidism or even potentially some hyperthyroid type symptoms? So what's the symptomatology? If they feel good, they function great, they don't have any signs and symptoms, maybe we just leave it the way it is. The other thing we need to ask is, what's the goal of the clinician? If they're just seeing a traditional allopathic endocrinologist who's prescribing T4, they might be okay with what these values are, especially if the patient doesn't have a lot of signs and symptoms of hypothyroidism. But if the person had a lot of signs and symptoms of hypothyroidism, they might want to give a bit more T4 to lower TSH even more. But chances are, low signs and symptoms or no signs and symptoms, they probably wouldn't be prescribed more medication. If they were complaining of more signs and symptoms or persistent signs and symptoms, they might be prescribed more thyroid medication just based on these values. What's the goal of the client? If the client is just looking to see if they need more medication to make them feel and function better, then maybe that's what somebody might want to do, is give them more thyroid medication based on these values. If they were seeing a functional practitioner like me, and I saw these values and the person still had signs and symptoms, and the patient's goal was to reduce the amount of thyroid hormone potentially, or just get that thyroid hormone to work better, or potentially need less and less medication in time, then we might say we need to take a deeper look at what's going on with the person's overall physiology. And again, we'd be asking that question: do they have hypothyroid signs and symptoms? Do they have any signs and symptoms of too much thyroid medication? And so the other thing that I always want to do is consider what the rest of the labs indicate. So I put up 3 scenarios here for a TSH of 3.5 and a free T4 value of 1.19. And so in this first example, the person's got a TSH of 3.5, total T4 is 7.1, total T3, it was 114. The person has enough T4 in the system, they have enough T3 in the system. Free T4 is 1.19, free T3 is 3.2, reverse T3 is 17.0. And if we look at the conversion of free T3 to free T4, it's 0.32 with a reference range of 0.31 to 0.34 in picomoles per liter. So this would be a person that I would say, no, this is not a case where the patient probably needs to take more T4 to suppress TSH. There's enough thyroid hormone into the system. They're doing a good job overall at the cell level converting T4 to T3. So if this is a person who felt good, didn't have signs and symptoms, I would tell them there's probably no need. If this was a person who still had hypothyroid signs and symptoms, despite these values, I would get busy trying to indicate what else might be causing those signs and symptoms. In example number 2, person has TSH 3.5, they have a total T4 of 5.1, which is a bit functionally low. The total T3 value is 85, which is again functionally low. The free T4 value is 1.19, and the free T3 value is 2.3. So the free T3 value is less than optimal. Reverse T3 is at 15, and the free T3 to free T4 ratio is 0.23. So initially you might consider that this is a person who might need more thyroid hormone replacement, maybe more T4 in this situation. Some people might say T3. I would say this is a person who might need some more in time, but at the moment, they are not doing a great job of converting free T4 to free T3, with that ratio being 0.23. And with that ratio being low, then this would be a case where I would advise the patient not to go up in their T4 medication and really get busy trying to figure out why the cells and tissues aren't converting T4 to T3 like they should if there's less than optimal levels of thyroid hormone in the system. Look at reverse T3, it's not overly high. This is a person who you start to consider, this is a person who they don't have a lot of thyroid hormone. TSH is probably elevated because T4 and T3 are functionally low, but they're not converting what they have well from T4 to T3. So more T4 into the system is probably not going to be beneficial. And this is that kind of cell stress response going on where the cells and tissues are sensing some type of stress or danger. I would be looking at the rest of the panel, especially some inflammatory markers, to see if there's inflammation or other indications of some type of cell stress response going on, that the cells and tissues aren't converting that T4 to T3. Some people might say, well, maybe there's a deiodinase 2 polymorphism that's preventing the conversion. That's possible, but I don't think that's the likely scenario here. So this would be another case where I would get busy trying to figure out why the cells and tissues aren't converting T4 to T3 optimally. And then in this scenario, the last scenario, this is a person with TSH 3.5. Total T4 is 5.1. Total T3 is 75. Again, functionally low, almost lab low. Free T4 is 1.19. Free T3 is 3.5. And reverse T3 is low. So, and then when we look at the free T3 to free T4 ratio, it's 0.35, which is higher, indicating that as fast as the cells are getting T4, they're converting that T4 to T3. So we have a higher conversion. So this is a person who probably would do better with more T4 in the system so that they can get more T4 converted to T3. So this would be a person I would give the recommendation to the patient to say, and to the prescribing physician, that this is a patient who probably would do better with more thyroid hormone replacement in the short run. So for the person who asked that question, hopefully this helps. If you have any questions regarding this interpretation, put them below wherever you watch the video, okay?